After the war, a Civil War surgeon named Dr. Andrew Taylor Still wanted to have more tools to use in modern medicine. He developed techniques that he could do with his hands that would support the body's own self-healing capacity. I'm Dr. Bob Foster from the West Virginia School of Osteopathic Medicine. Today, we're going to have Dr. Cece McClay, DO, work with a couple of medical students from WVSOM to briefly show us techniques that can be used for influenza and that were used in 1918.
Student Dr. Keffer is going to start by demonstrating the cervical thoracic junction release. She's going to place her fingers around the base of the neck. Her thumb is at the top of the shoulder and her fingers are draped over the collarbone. She's going to sink her fingers into the tissue and then she's going to rotate this whole area to the right and to the left. She's going to hold it in one of those directions for 30 to 60 seconds until the tissues release. This will help drain the lymph from the head region. Now she's going to demonstrate facial effleurage. She'll turn the head to one direction, place her thumb at the base of the ear, and sliding down the sternocleidomastoid muscle, down to the clavicle, down to the collarbone, 3 times. She will help to drain the lymph out of the head. She would do that also on the other side, but for purposes of the video today, we'll move on to the forehead. She'll put her fingers together at the top of the forehead and let them sink into the tissue and go out to the sides to the hairline. Then she'll move halfway down the forehead, do this again, and then above the eyebrows, and again out to the hairline. She would do this 3 times, but we're going to move on to showing you the nasal portion. Sinking her fingers in, she'll move out to the hairline, and she would do this 3 times. This drains the maxillary sinuses, and a moment ago on the forehead, that drains the frontal sinuses. Thank you. Now we're going to show you the suboccipital release. We're going to rotate the head into one hand, and then place your fingers under the base of the head at the base of the skull. Her fingers will sink into the tissues here and help to cause some relaxation. She will now demonstrate. She's placing her fingers at the base of the skull, rotating the head onto it, placing her fingers on the other side. Her hand is resting on the table and her fingers are pressing up into this region, and the weight of the head is helping to give the weight so that those muscles can relax. This releases the muscles that attach to the base of the skull. It also helps balance the autonomic nervous system and can treat headaches and congestion in the head. Next, she's going to demonstrate the thoracic pump. The patient will place their hands over the top of the chest. She will place her hands over those, and then she's going to sink her body weight in and jiggle herself and the patient so that she's not stressing her arms, because she'll be doing this 100 times a minute. This is the major technique for draining the lymphatic system, which will help to promote good balance in the immune system. Next, she's going to demonstrate rib raising. The lungs act as a bellow, and when we cough, the ribs can get very sore. So she's going to demonstrate feeling the spine and then going off to the side into the soft tissues between the spine and the ribs. In this region, she's going to be putting some pressure in. She'll be doing this with the patient lying on their back. Right now she's demonstrating the location. Patient will roll over into her back, and she will demonstrate placing her fingers off into the soft tissue between the actual spine and the ribs, so she's not on bone. She will lift her fingers up into this region, pressing her arms down into the table. And you can see the actual ribs rising and falling. She'll adjust her position, going down a little bit. The ribs go down about 2/3 of the way on the chest. This helps to relax and balance the autonomic nervous system, as well as help to soothe any bony malalignment that may have happened with the ribs because of excessive coughing. Next, she's going to demonstrate the pedal pump, which is another technique for the lymphatic drainage. She's pressing her hands into the base of the foot. She's using it as a leverage to shake the whole body She'll shake the body 100 times a minute. This is another alternative to the thoracic pump. It's easier sometimes to reach the foot of the patient. These are preventative techniques that you can do on each other at home when you are in the flu season. If the patient is sick, the patient would most likely be wearing a mask so that when she coughs, she does not spread her sputum, which could be infected. The practitioner at home, although she's a family member, if she's not sick, she could be wearing a mask also, as well as gloves. She also could be wearing a large shirt so that any of her body that touches her family member who is sick, after she's done, she could take the shirt off carefully, not touching the outside of it. Thank you very much.
Now you've seen a review of those techniques. I wanted to remind you all that when you're treating patients, loved ones, family, always wear a bandana, and you can get 4 layers with 1 slight fold, and the patient should wear one as all. So, please be safe and be well.